Hello, everybody, and welcome to the Seven Corners November Agent Webinar. My name is David Fisher, and I'm the Chief Revenue Officer for Seven Corners, and I'll be filling in for Tim Berkey, our Director of Marketing, who's away at a Salesforce conference. Although I've gotten the opportunity to go out and travel and meet many of you, I certainly have not had the chance to meet all of you. So for those of you who do not know who I am, I've been with Seven Corners for just a year. I've got a background in sales leadership, global, predominantly in the manufacturing enterprise software space. So it has been an exciting year for me, and I'm even looking forward to a more exciting year coming ahead. So first and foremost, I want to take the time to tell you thank you for spending the time with us this afternoon. We appreciate you tuning in, and we're looking forward to a good session today. In today's webinar, it's the sixth and final one for 17, but we will most certainly be coming back in 2018 with new and helpful content for you. So we want to hear from you to make sure that we provide relevant information that makes sense for you. Remember, these webinars are for you. As far as the future webinars, we're going to continue to notify you about the upcoming dates, topics throughout the month, and agent updates. You can always find that information about future agent webinars at sevencorners.com/agent. And I want to remind you, please ask questions. We do want your involvement. You can type them into the GoToWebinar panel, and we'll answer them at the end of the webinar. If we run out of time and we don't get to your question, don't worry, we will get back with you. On today's webinar, we have three guests, and we're going to be focusing on three areas. Our first guest is Amy Brown. She's our Chief Operations Officer, and we'll talk about our customer experience, service, and updates. Then our Director of Medical Management, Debbie Mathis, will be here to explain and why pre-certification is important for you and your clients. She will also explain how pre-existing conditions work and the role her team plays in emergency medical evacuations. And finally, we'll have Dave Boggs, who's been on many of these webinars with us, and he is our Sales Operations Manager, and he will share marketing and sales initiatives that we have planned for 2018. Our first presenter today is Amy Brown, Chief Operations Officer for Seven Corners. She has been with us for just over a year and a half, joining in May of 2016, and brings in excess of 18 years of experience in healthcare and government. Immediately prior to joining Seven Corners, Amy served as Chief Operations Officer at an outsourced services company in the biopharma manufacturing industry. Amy has also served as Vice President of Government Programs for provider-owned management care organizations where she oversaw Medicaid, Medicare programs, and administration. In addition, she has held leadership positions for the state of Indiana and was awarded the Sagamore of the Wabash for her service in developing healthcare policy for the governor's office. Needless to say that we are happy that not only is she at Seven Corners, but we're very excited to have her join us today.
Thank you, David. Thanks for inviting me to the webinar today, and it's my pleasure to spend a few moments sharing details about the work we are doing within my team, which is comprised of Seven Corners team members who handle all post-sale customer interactions. This includes customer service, our 24/7 emergency assistance, and our claims administration. So everybody needs a reason to get out of bed in the morning. And here at Seven Corners, our motivation and inspiration comes from our core focus. By that, I mean we strive to be the difference for our customers when they are in need while they are away from home. In customer service, assist, and claims, we have the awesome opportunity to be the difference maker every day for our customers. We do this by helping them recover losses after they've been through an unfortunate circumstance. We've also support and facilitate quality health care when they are experiencing a health crisis, and we're a friendly and helpful resource when they are in an unfamiliar territory. Over the past year, our customer service team has worked to understand our insured's needs and expectations around our service. Specifically, we have set out to learn more about how they prefer to contact us and how they want to receive and transmit information to us. Based on our preliminary findings, we have established some new expectations for ourselves. These include ensuring our staff are trained to resolve the member's question or concern greater than 90% of the time on the first call, answering calls or chats live in less than 40 seconds, and providing in-house translation and interpretation services for the most frequently needed languages. To help us measure how we are doing and to ensure we are continually improving, we have deployed specialized tools. The first of these is a third-party quality monitoring service, which includes a team of call center experts who listen to our calls and collect data about them. They evaluate elements of the call, such as did we listen well to the customer and were our verbal skills appropriate, and many other methods for providing excellent service. We then use that information to train and encourage our teams. We have also begun using Salesforce Service Cloud. This platform allows us to track customer communications throughout their journey with us and gives us a clear view of their needs and situation along that journey. We are excited about using these tools to service our members better. So to understand how well we are truly being the difference for our customers, our most important measure of success is what our members are saying about our service. To find out how our members feel, we looked at data from several trusted sites, including Google and some of the larger insurance aggregator sites, as well as details from our member review platform, which is called Trustpilot. The graph you see demonstrates the volume of customer reviews that specifically mentioned our customer service. Not only are our total number of reviews up by almost 300%, but the ratio of compliments to complaints for our customer service is almost 4-to-1. We are pleased to see this big improvement, but we are not resting here. We're moving on to discover additional ways to provide service even better. We know the last thing any traveler wants is to experience a situation that causes them to file a claim. Our claims team is passionate about not making a member's already bad situation become worse through an inefficient or unhelpful claims process. We have aspirations as well as a roadmap to get there to make our claims process simpler and more user-friendly than anyone else providing travel insurance. While we still have some work to do, I'm proud of the accomplishments we have already made. I'd like to touch on the processing time for claims. The numbers you see on this slide may look greater to you than were previously. This is partially because we are now showing the count to include weekends and holidays instead of just business days. This is part of our continued effort to view our service from the customer's perspective. The customer simply wants to know how long it will take to get their claim paid, and we are sharing now that information in a more transparent way. In addition, the count is higher due to both the busy season and increased claims related to the many natural disasters that have occurred in the past several months. Within the last year, we focused on an initiative to improve the quality and friendliness of our claims service. Because of that, we dramatically reduced customer complaints from public review sites while increasing the number of compliments. You can see the clear pattern change from 2016 to 2017. We have also invested in claims processing efficiencies to ensure that claims are processed timely. Customers who publicly reviewed Seven Corners claims processing have increased their compliments by over 250% from 2016 to 17. While we are very proud that customers are inspired to post positive reviews of our customer and claim service, we will make additional investments in 2018 to enhance our online member portal, as well as provide more simplified and customer-friendly communications for claims processing. We invite your feedback as we continue to learn about how to improve our customer service. Lastly, I wanted to remind you of two of our competitive advantages that customers love about Seven Corners. Regarding our international provider network, we are proud of our open network of 14,000 medical doctors and hospitals throughout the world with whom we have built a proprietary partnership over the past 24 years. Additionally, we have partnered with United Healthcare on the U.S. network, which offers our members a robust set of provider options for specific product lines. We have also launched a new page on our website, which helps educate consumers about the emergencies that our customers have experienced while traveling and how our 24/7 emergency assist team helps these insureds when they need it most. You can find this page under our emergency assistance link on our website at sevencorners.com/help/assist. The map shows the world, and you can zoom it in or out to view various countries. When you click on the plus signs, you will see details about recent emergency situations Seven Corners Assist has handled. So that's all I have for today. Thank you very much for your time and attention. Our team looks forward to servicing your customers with excellence in the years to come.
Thanks, Amy. It's been absolutely amazing watching you and your team drive the improvements that our customers need to drive better customer service. And we're even looking forward to greater improvements 2018. Up next, we have Debbie Mathis, our Director of Medical Management. Debbie has over 29 years of experience as a registered nurse, and she's been with Seven Corners since 2013, managing a team of RNs who play a key role in many areas of our business. Debbie has been instrumental in developing and executing our pre-certification process. In addition, she and her team also perform medical management for insurance and government plans and work closely with Seven Corners Assist emergency medical evacuations and other emergent medical situations for our members. With that, welcome, Debbie.
Hello, I'm happy to be a part of the webinar today and look forward to talking with you about the medical situations we deal on a daily basis. I'm going to begin by talking about pre-certification and pre-notification. Many people are confused about the difference between these two, and it's important for your clients to understand them. Pre-notification is found in many of our plans, and it essentially requires the member to contact Seven Corners Assist for several different scenarios that are listed in the plan document. As the name implies, it is really just a notification to us. Examples of situations that require the insured to notify us include within 48 hours of an emergency hospital administration anywhere in the world, before a scheduled non-emergency hospital admission anywhere in the world, before receiving medical treatment in the U.S., and before inpatient or outpatient surgery worldwide. For pre-notification, we simply receive the information and note it in the file. There is no review of medical information at the time of notification. With pre-certification, the member and their physicians notify us of the diagnosis and recommended treatment before the treatment is provided. We step in and review the medical records at that time, often talking with the physician. We look first to see if the situation is covered under the policy, and then we check to see if the condition is pre-existing. Because pre-certification gives us the opportunity to look at the medical condition, medical records, and treatment plan ahead of time, it is beneficial for everyone. It prevents us from paying for treatment that is not appropriate for the medical condition or for a condition that is not covered under the plan. It's helpful for the member too. If we determine that the treatment and/or condition are not covered, then the member can decide if they really want the treatment immediately or if they would rather wait until they get home to have it covered in their home country's health plan. This could save them from a huge bill. Obviously, this doesn't apply in a life or death situation. In that case, we do a retro review evaluating medical information after the surgery or other treatment. It's important for the member to review the pre-certification requirements in their plan document because there is a penalty typically associated with failure to pre-certify, and it can be a stiff penalty, such as 25% reduction in covered expenses. Some plans only require pre-certification for treatment in the United States. This is because it can be difficult to pre-certify treatment overseas. Again, it's best to check the plan document to know when you need to pre-certify. Let's talk about a couple of examples of pre-certification situations we've seen to make this easier to understand. We had a situation recently where a member was scheduled for a meniscal tear surgery, which we agreed was appropriate treatment. However, along with the surgery, the physician ordered a lot of durable medical equipment. This was an unusual request for the diagnosis and treatment. After digging deeper, we discovered this equipment was not needed, it wasn't medically necessary, so we declined to cover it. Another situation involved a member who was overseas and wanted stem cell injections for a knee tear. We adhere to U.S. standards for what is considered approved treatment. Because stem cell injections for a knee tear are considered experimental in the U.S., we could not cover this. Now I'd like to touch on pre-existing conditions and focus on acute onset. This is often a confusing benefit. On some plans, we offer coverage in the United States for an acute onset of pre-existing condition. It's important with this benefit to note the definition of acute onset. It is a sudden and unexpected outbreak or reoccurrence of a pre-existing condition which occurs spontaneously and without advance warning and requires urgent care. I think the best way to explain it is to give you some examples. If you have lung cancer and you're suddenly short of breath, that is to be expected. So it would not be an acute onset because the symptom you're experiencing is anticipated. If you have high blood pressure and have been on medication controlling it and then have a sudden heart attack, this is not expected. An acute onset would likely be covered. If you have diabetes and you're using insulin as prescribed by your physician and you routinely check your blood sugars and they are within normal limits, you suddenly end up in a diabetic coma. Again, this is not expected and would probably be covered by the acute onset. To make recommendations for these situations, we always check medical records and involve our staff physicians as needed. We communicate with the hospitals or treating physician regarding the member's diagnosis, condition, and treatment, and take careful look at the information before making a decision about whether or not a condition is eligible to be covered. To expedite the process of identifying conditions that are more likely to be pre-existing and therefore need to be reviewed more closely, we've created a reference list for our claims analyst. It includes conditions such as coronary artery disease, cancers, diabetes, orthopedic injuries, rheumatoid arthritis, to name a few. In addition, if our claims analysts have questions about a condition, they can reach out to the medical management team for help with those as well. Finally, I'd like to talk about the role the medical team plays in emergency medical evacuations. First, we receive notification from Seven Corners Assist of a possible evacuation. We then reach out to the treating physician and medical facility to obtain details about the member's current condition and their treatment plan, including a potential discharge date. We talk with them by phone and by email, involving translators as needed. During this process, we carefully consider whether the current facility can provide appropriate care to our member. Once the member can be moved, whether they're going to another facility or back home, we determine if they need special assistance, perhaps an escort or family member to travel with them. Do they need oxygen or maybe just a seat that reclines? These are the types of needs depending on the situation. Our goal is to provide our member with appropriate care and return them home as quickly and as safely as possible. To do this, our medical team operates 24/7 with an RN and a physician on call always. Throughout a medical evacuation or other emergency situation, we ensure continuity of care, meaning the same nurse stays with the member from start to finish. This provides better care for the member. Our medical team loves what we do. We get to help our members on a daily basis, and we also get to work with amazing people here at Seven Corners and all over the world.
Wow. Thanks, Debbie. It sounds like you and your team are busy around the clock and around the world. Thanks for talking to us today about what you and your team does to assist our members globally. Our final presenter today is David Boggs, Seven Corners Sales Operations Manager. Dave has been with Seven Corners for close to 2 years. He has more than 28 years of insurance sales experience and has devoted the last 13 years to travel insurance specifically. We are excited to have him here so that Dave can talk to us about the marketing and sales initiatives that he has planned for 2018. Welcome, Dave.
Thank you, David. 2017 is on track to be a successful year for Seven Corners. We have been working closely with many of our existing agents and our new agents, exploring new markets, products, and processes to generate revenue and success for our agents and for Seven Corners. However, and most importantly, we continue to explore new ways to enhance your client's experience with us today, tomorrow, and well into the future. In 2017, we received several suggestions about ways to enhance the consumer online purchasing experience to increase sales. In addition, we performed user testing and uncovered key areas of improvement for our homepage and for the sales funnel. And then over the past 60 days, we experimented with enhancements to both of these with regard to content and the functionality of the sales funnel itself. Well, we are happy to announce that these changes have been successful. Many agents that are utilizing the online purchase links are seeing an increase in sales. We are now in the process of researching additional ways to improve the online consumer purchase experience even more for 2018. Along with enhancements to the consumer purchase experience, we've also begun the process of reviewing our portfolio of products for 2018. We are beginning with the Liaison series of products. This includes Liaison International, Liaison Continent, Liaison Express Group, Liaison Majestic, and Wonder Frequent Traveler. We are currently conducting research that includes market and competitive analysis, agent input, consumer input, and a performance assessment for each product. This will assist us improving our products to make them more consumer-friendly and easier to sell. In doing so, we will consider consolidating plans, new or enhanced benefits, and even optional riders, such as adding a crisis management benefit to our travel medical family. Finally, we will also consider new products that are not addressed by our current portfolio. Now, please excuse our mess in 2018 as we begin work on enhancing the agent portal. Yes, this portal will be undergoing a reconstruction project in 2018. We understand that as more and more business is sold and managed online, we need to enhance the technologies and tools that you have at your fingertips to better manage your business with Seven Corners. Enhancements and changes to the agent portal will include a redesigned main landing page with a production summary dashboard and more user-friendly icons for navigation and posting of the most recent news. The ability for you to update and maintain your own contact demographics. Options to search and view client information. The ability to mail email ID cards. Access to the group portal to assist in managing group business. Sales and marketing enhancements, including a new brochure and/or flyer building tool that allows for personalization and self-printing capabilities. The ability to generate, store, and email quotes to clients. Reports that provide more flexibility in search parameters and output. And finally, greater flexibility in communicating with staff in various departments throughout Seven Corners. And speaking of communications, the test of any mutual beneficial relationship is the sharing of information between parties. In light of this, we will be improving and increasing our communication with you in the upcoming year. How will we communicate? Well, in February 2018, as mentioned, our agent webinars will begin for the year, and we will host these webinars on a quarterly basis. We will also conduct product webinars as new products and enhancements are released and continue with ongoing product training. We will continue with our monthly agent newsletters. This is a valuable tool to keep you up to date about Seven Corners, our marketing and sales opportunities and ideas. Our external and internal sales team will increase their direct communications with you. Also, we will continue to solicit your input via surveys and phone calls. And finally, we will expand our experienced licensed staff of sales support specialists to answer your inquiries efficiently and timely. In 2018, we will continue another aspect of our commitment to you with our agent recognition program. This will be a formalized program that includes the current Jumpstart bonus program for new agents, sales contest, e-commerce recognition, and of course the Summit Award program for top agents. We ask, and please feel free to send all suggestions about enhancements or changes to the online purchase experience, our products, the agent portal, the agent recognition program to our sales team. Our contact information is on the slide for you, and we want to hear your ideas. Well, David, that wraps it up for me, so I'll turn it back over to you now. Thank you.
Great. Thank you, David. Sounds like we have a lot to look forward to in 2018. I'm excited to see this come to fruition as we move forward. We've covered a lot of ground today, and I'd like to take some time for some questions from you. Okay, it looks like we've got a question coming in. So Mike has a question for you, Dave. What types of marketing pieces will you have for us in 2018?
Well, we're going to begin creating pieces that may be market-driven, such as if you're in the student market, the missionary market, general information pieces that you'll be able to take and imprint, once again, your name and contact information on these types of flyers that you'll be able to access through the agent portal and then print if you're going to, say, a conference or a webinar.
Great. Thank you, Dave. Looks like we've got a question from Rhonda C. Amy, the question's for you. Amy, can you talk more about the online member portal, what it is, what members can do with it? Sounds like you were going to make improvements to it all.
Yes, we are. So our member portal is a tool that really allows our insureds to take management of their relationship with us in their own hands. Right now, the functionality allows them to log in and check claim status, view their ID card and print it, as well as manage their enrollment in their programs. Going forward, we know we want to promote and enhance those services for our members, offering things such as being able to view dependents in one view in the member portal would be one of our enhancements, as well as more self-service options for logging claims, as well as getting better detail on managing their own policies.
Great, thank you, Amy. And we also have a question from Michelle P. Debbie, this question is for you. How hard is it for you and your team to determine if a condition is pre-existing?
Our staff of physicians and nurses have vast clinical experience to draw from, and that coupled with the appropriate medicals makes determining pre-existing fairly straightforward and easier to determine. If we don't have the medicals that we need, we request those, so we have the whole entire picture to make that determination.
Great, thank you, Debbie. Well, it looks like that's all the questions that have come in. A recording of today's webinar and all previous webinars are available at sevencorners.com/agent/webinars. So if you missed a topic and you're interested, you always go back and watch them there. So I want to talk one more moment about the plan we have for our webinars in 2018. As Dave mentioned earlier, we will move with these monthly meetings to quarterly, and our first one for 2018 will be February 14th. We will also be supplementing these webinars with additional ones as needed as topics come up, and we'll certainly continue with our product training webinars for 2018 as well. Please look for these topics and information about the upcoming webinars in your agent newsletters. We will continue to send them to you on the third Wednesday of every month. Again, thank you all for taking the time to join us today during your busy day. Have a fantastic and productive end of the year.